Hello everyone, I'm Youngji from KAIST. Today I'm going to present my research about context-aware mental health self-tracking using multimodal smart speakers in home environment. Recently, a growing number of people have mental health issues. According to a recent study, approximately 1/8 of the world's population live with a mental health problem. So there has been a need for managing and improving mental health issues. For managing mental health, it is important to monitor dynamic changes in user states on a daily or hourly basis. Previous studies have used the self-tracking method for mental health monitoring because it is suited for observing the user state continuously. Self-tracking supports users in collecting and reflecting on their data, and users can enhance self-awareness and understanding of their mental health. It is also widely used as a clinical methodology because it helps bridge the information gap between healthcare stakeholders and patients for clinical decision-making. Meanwhile, people with poor mental health tend to stay at home for a long time. This situation emphasizes the need for mental health self-tracking methods for home environment. For mental health self-tracking, ESM is a well-known methodology that asks users to complete surveys at various points in their daily lives to collect data on their mental health state. Traditionally, ESM has been based on the paper and pen method. With advances in ubiquitous technology, ESM also has been actively used with mobile phone and wearable devices. Recently, with the increase in the adoption of smart speakers at home, smart speaker-based ESM has also emerged in home setting. Smart speakers have traditionally been focused on voice interactions, but the market has expanded to include multimodal smart speakers that support voice and touch interactions. These multimodal smart speakers provide new opportunities to perform mental health self-tracking tasks with visual elements. For example, there is an image description task for diagnosing depression or cognitive impairment. In that sense, multimodal smart speakers can collect more diverse types of mental health data that cannot be collected with traditional voice-only smart speakers. Despite the benefit of multimodal smart speakers, previous studies have mainly utilized voice-only speakers to conduct ESM research in home environments. So, we aim to explore user experiences of mental health self-tracking with multimodal smart speakers. Also, one important aspect of ESM design is to determine the opportune timing for delivering ESM surveys. Previous studies identify opportune moments to proactively interact with users. For example, in mobile and desktop environments, there are moments when users switch tasks from one thing to another. Those are the task breakpoints that are used for opportune moments. In mobile environments, activity transition when a user changes from one activity to another are widely detected as opportune moments. However, to the best of our knowledge, studies on identifying opportune moments detected by IoT sensor in home environments are still lacking. Therefore, we aim to explore user interruptibility in response to ESM based on context transition detected by IoT sensor in home environment. In this study, we developed a context-aware self-tracking system using multimodal speakers at home. Our system is comprised of two main parts. The context-aware ESM scheduling determines opportune moments for ESM requests. Multimodal ESM survey allow users to respond to ESM requests through voice and touch interactions. This is our system prototype. For context-aware ESM scheduling, we use an IoT sensor and a smartphone with a wide-angle lens. They collect CO2, noise, brightness, and the number of people. For the multimodal ESM survey, we use a Google Nest Hub smart speaker. ESM surveys were requested when opportune moments were detected or when the maximum request interval had timeout from the last request. For requesting ESM at opportune moments, we detected changes in one of the two user contexts. we detect changes in the auditory channel availability using a noise sensor. We also detect changes in human presence near the speaker using a light sensor, CO2 sensor, and camera. Environmental conditions such as average noise levels may vary between homes. Therefore, 4 sensor-based trigger conditions were set at different thresholds. To ensure that these thresholds accurately reflected real-life conditions in users' home, we individually calibrate the thresholds for each home. Regarding the ESM task, speakers provide the survey in voice and visual modalities. Users can choose one of them to answer. ESM task consists of 4 steps. The speaker asks about the user's activity before the conversation with the speaker to capture the user's context. Picture description tasks have been widely utilized to collect and analyze voice data to diagnose mental health issues. We set the following research question. The first question is how do users perceive proactive mental health rep tracking using multimodal speakers? The second question is how do ESM compliance rates change across different context transitions? The last one is what are the preferred interaction modalities for responding to multimodal speakers? For the field study, we recruited 20 participants. Our recruitment criteria included people who were diagnosed with at least mild depression, who had private spaces at home, and people who spent a minimum of 5 hours daily in their home. We conducted a 4-week field study. Before the study, we asked the participants to watch an instructional video of the study. Then we visited each participant's house to set up our ESM system. The devices were installed in locations that offered a view of the entire personal space such as desk according to the participants' preferences. After the 4-week field study, we conducted post-surveys and interviews. Regarding RQ1, we explored the overall user experiences of mental health rep tracking using multimodal speakers. First, most of the users mentioned the effectiveness of proactive rep tracking. Users reported that the proactiveness of the system allowed them to reflect on their mental health. Some users even said that the survey process was emotionally beneficial as it helped them release their emotion and refresh their mood. These findings suggest that our proactive self-tracking service can increase self-awareness regarding mental health. Users also generally agreed that the human-like factors made users engage in responding to ESM requests. The speaker verbally asked questions along with the screen display. This multimodal interaction made the speaker feel like a person, increasing immersion when responding to a series of survey questions. Furthermore, non-periodic ESM timing was considered an additional human-like factor. Meanwhile, users negatively evaluate the speaker's machine-like interaction styles, such as repeating the same surveys without any tone or content variation. The user became bored by repeating the same questionnaire. This suggests that boredom can affect the quality and quantity of the data collected through self-tracking. Regarding RQ2, we analyzed the ESM response rates across different trigger conditions and different periods of the day. First, we calculate the response rates by trigger type and time of day. In the case of trigger type, our sensor-based condition had higher response rates than the time of trigger condition. In the case of time of day, the response rates were lower in the morning. We also compared whether the sensor-based trigger conditions and the time of day significantly affected the user's responses to the survey. Our results showed that our participants were more likely to respond to ESM surveys in the afternoon and night compared to the morning. In addition, users were more likely to respond when ESM is triggered by CO2 human presence and light conditions than the timeout conditions. However, the noise sensor-based conditions were not statistically significant. This could be due to the lower number of trigger attempts compared to the other trigger conditions. Regarding Arcus 3, we analyzed user preferences in interaction modality selection by the user context. Most users reported they generally preferred GUI for the multiple choice questionnaires. They reported limitation of voice interaction such as the need to wait for a speaker and the speech recognition error making them use GUI. Also, they were much more familiar with GUI. Nevertheless, VUI was preferred, particularly when users perform tasks that require the use of hands. Our interviews revealed a general preference for GUI, but the VUI was preferred in scenarios where user hands were occupied. So, we explored previous activities before responding to ESM for each interaction modality. In this figure, mixed is answered by alternating between the two modalities. Overall, media usage and studying working were the most frequent activities in GUI, VUI, and mixed. Users preferred the VUI or mixed more than the GUI when they were doing chores and personal hygiene. Our statistical results also showed that the users were more likely to respond via VUI or mixed for doing chores and personal hygiene. It supports the argument that users prefer VUI or mixed in scenarios where their hands are occupied. We review our major findings. First, we found proactiveness and human likeness have users engage in self-reflection. Second, we demonstrate that the user response rate improved when ESM are requested in context transition. Finally, we also found that the user's previous context influenced their interaction modality selection. Through these findings, we tried to discuss sensor selection in home environments and context adaptation support. In our study, we employed IoT sensors to monitor users' activities at home. Among the IoT sensors, users are mostly concerned with cameras. So it is important to use less privacy-invasive sensors. Also, the home is generally a multi-user environment. So it can be extended to consider mobile and wearable devices for multi-user detection. We also found that the user's previous context influenced their interaction modality selection. Therefore, it would be helpful to detect such user context using sensor and adaptively select an appropriate response modality. Based on this discussion, we now propose several implications for designing context-aware mental health self-tracking using multimodal smart speakers. First, we can consider a mental health self-tracking system that supports multimodal interaction. Currently, most of the self-tracking systems are largely GUI-based. However, there are situations where voice-based interaction is required. Also, voice-based interaction assumes synchronous turn-taking in dialogue management. In this case, the context sensing parts must be tightly synchronized with conversational interactions. Then, to improve user engagement, we can vary the tone and content of the self-tracking system. Users expressed boredom due to the repetition of the same questionnaire. Also, we can encourage users to reflect on their data. So, our key take-home message is that we need to consider context awareness to improve user compliance with the system. Therefore, more HCI studies continue to investigate context-tailored adaptation for making users engage in mental health self-tracking. Thank you for your attention.